Hello everyone, my name is Ashish Kumar. I'm a student at Sri Venkateswara College of Engineering. I'm currently in my 8th semester pursuing my engineering degree in information science and engineering. This video was made in regards of the technical seminar which I'm about to give you. This this video is in reference with blockchain in health industry. The paper that we have referred for this video is an IEEE paper which has an open access. You can access the paper through IEEE Access site. The topic of this seminar is blockchain-based processing of health insurance claims for prescription drugs. Moving on, this video was made under the guidance of Mr. Marianavan JR, Assistant Professor at SVC, Department of ISC. The technical seminar is on the topic of blockchain-based processing of health insurance claims for prescription drugs. So, the contents that we are going to go through in this video would be introduction, related background, working implementation, future enhancement, conclusion, and references. First, coming to the introduction. So the health insurance sector has been increasingly studied to improve the current crumbling traditional system. A health insurance claim is a bill that represents a transaction between a medical service provider and an insurance company to cover the expenses of a patient obtaining a service such as a medical, pharmaceutical, and dental services. So, what this paragraph says is the health insurance sector has been increasingly studied, and although the traditional system seems to be efficient, it is not, and we'll be looking into all the major concerns, major issues with the traditional system. This video is mainly on the topic of health insurance claim. So we'll be looking at looking at all the uh, problems that are being faced in the health insurance claims. So the health insurance claims are of two types, the cashless and reimbursement. In the reimbursement type, the patient pays out of pocket for all services rendered by the physician or hospital, and the insurance provider reimburses. So this is basically where you pay it out of your pocket and then it gets reimbursed. In cashless claims, the insurer directly covers all hospitalization expenses for the hospital cashless claim. An insured must be hospitalized exclusively at a network hospital approved by the insurance provider. Cashless claims cover both planned and unplanned hospitalization. In this research, we are considering cashless as it is the most popular type of claim universally. Now, so in cashless claims, basically the insurance company directly pays to the pharmacy or to the service provider. So in this paper, we'll be focusing more on cashless claims and all the problems that it has. So this figure represents the typical process flow for processing health insurance claims for prescription drugs. Now, this is the traditional system. What happens? This is basically the typical flow of what happens when you go to claim an insurance. So, patient approaches a network hospital for cashless medication. So, he goes to a medical care facility. After registration, patient is referred to physician for diagnosis, where the physician writes his medical codes based on the diagnostic results and issues an e-prescription. E-prescription is again electronic prescription and it is fed into the healthcare system. A network pharmacy is notified to process the e-prescription. So whatever the pharmacies or whoever the pharmacies are in contact with us or like the entire network, they will get notified and they'll take care of it. The pharmacist contacts insurance company for approval. Now here comes the company into play. So insurance company evaluates the claim based on their policies and patient's insurance claim plan. Based on this, there will be two outcomes: either it's rejected or it's approved. Now, this is the traditional system, and on the very like your surface level, if you look at it, you don't see a problem, you don't see the major concern. You would be like this, there's no problem in this, why should we improve it or why enhance it? Well, there is problems. As we move further into in the video, we will get to know them. So recently it came to the realization that this system is struggling with many drawbacks, such as claim abnormality, security and privacy issues, time and cost consumption. The most significant disadvantage is claim abnormality, which can be divided into three categories: fraud, abuse, errors. A fraud claim is one that is purposefully deceived, misrepresented, or concealed in order to obtain payment for the insurance company. Abuse claims result in unnecessary costs through the use of exorbitant or inappropriate medical services that do not align with the acceptable business or medical practice. Errors are unintended mistakes made by one or some of the parties that cause improper payment. Now, these abnormalities, they cause major loss of money to the government and insurance companies, and this is one of the problems that we need to take care of, and this is one of the major problems that actually exist. Now, as we discussed, there are many problems with the systems. So if you look at the first claim, which was about money, so we can see, according to the stats, fraud claims waste 15% of the total claims in the insurance sector. Now, 15% does not appear to be a large number until you really put them into the numbers. So, about 6 to 8 billion Indian industry loses between like 6 to 8 billion INR as per results of counterfeit claims. Now, in the US, it is somewhere around 77 billion to 259 billion dollars, and that's a lot of money, by the way. So in 2020, also if you look at another reports, we get to know that in 2020 345 defendants were charged with fraud, which involved 100 doctors, nurses, medical professionals, and all these people are people who we trust. These are supposed to be trustworthy people, but yet they were involved in the fraud. In UK, it was reported that they lose over 1 billion pounds per year. So this is one of the major concerns with the traditional system, and this is majorly because the entire system is dependent on trust. It's running on trust. So that is one of the problems. The another issue is privacy and security. So the insurance claim, as stated before, includes information about the patient, which causes a major concern about the security of their information. You see, these these type of systems, they contain very sensitive data which is very personalized, which is very sensitive, and which is very important and crucial. This type of data can be used against us. This type of data is something that needs cybersecurity. However, it was researched and it was discovered that it is ranked lowest in cybersecurity among other industries globally. So it has failed in almost all, all components, like security at the cloud environment. We have data centers, desktop, laptops, you name it, it failed in it. So cybersecurity wise, it is very vulnerable to attacks, breaches. So our data is not safe at all. In the US, 50% people are concerned about their medical data since they believe the healthcare system is not properly prepared for cyber attacks, which they are not, by the way. Uh, in the first quarter of 2018, you can see that there were over 77 breaches of healthcare data and the data leakage of more than 1 million records. So this is another problem with the traditional system. The third and the last problem is time and cost of consumption. This traditional manual paper process takes time, effort, and money, and it is estimated that 375 billion is wasted by insurance companies in paperwork. So 375 billion dollars of worth of paper, you can say, is used just in this industry, which is again something that is not efficient, that is not economical. So Therefore, a novel system is highly required to overcome the major baggage that is caused by the current insurance claim system. Through this paper, we are suggesting one of the methods, one of the technologies which we can use. A blockchain technology based system is a strong candidate that will resolve the issues of security, trust, and transparency due to its features like immutability, distribution, traceability, and decentralization. A blockchain system validates and stores information and stores transaction in a decentralized ledger. To ensure data integrity, blockchain technology offers three essential conditions: immutability, transparency, and traceability of transactions. We propose a private Ethereum blockchain based solution to automate health insurance claims processes for prescription drugs in a fully decentralized, traceable, transparent, private, secure, and trustworthy manner. So you can see that with the help of a private Ethereum blockchain based solution, we'll be able to solve these major problems. Now, moving on to the next part of our video, related background. So I would like to give you the background related to this video. So blockchain technology was first introduced in 2008 as a distributed and public ledger. It records payment transactions between two parties in a peer-to-peer network without a trusted third party. That is, example, bank. Now, initially, the blockchain system only offered payment services based on the consensus protocol. This protocol allows distrusting nodes in a P2P network to reach a consensus on the outcome after executing payment transactions. The participants are from an open network and are awarded by the payment of bitcoins, which are mined through a cryptographic hash function named proof of work (POW). The success of Bitcoin led to the need for expansion in blockchain applications. So we all must have heard by now Bitcoin, which is a cryptocurrency. Bitcoin got really popular in the last few years. But also, one thing that I would like to clarify is that Bitcoin and blockchain are not the same thing. Blockchain is the technology that was used to build Bitcoin. Bitcoin is one of the applications of blockchain. One of the applications that got in immensely popular. So cryptocurrencies. Bitcoin is a form of a cryptocurrency, but they're not the same. Blockchain is a technology. So using this blockchain technology, we are suggesting a solution. Now, smart contracts were introduced to represent autonomous programs as well as a new paradigm of decentralized applications, DApps, that run on top of blockchains and include many smart contracts. So, if you're wondering what smart contracts are nothing but they're executable bytes of codes that are put on a blockchain. They are simply a if then else case scenario. So, uh, as the name suggests, smart contracts, it's a contract between, let's say, many parties that are involved in it. Now, this works according to if then case scenario. So, for example, if a condition is satisfied, then do and so, then do so and so. We are basically automating the process, and that's why it is called a smart contract between, let's say, two parties. The Ethereum system was launched to support smart contracts. It offers its own cryptocurrency named Ether, and it uses an account-centered model. So Ethereum, as we all know, it was the main purpose of it was to support the smart contracts. It was built for the purpose of smart contracts. And in this paper, in this video, we are taking into account Ethereum system, a private Ethereum blockchain. Now, many applications including AI, IoT, digital assets have successfully adopted Ethereum. The Ethereum architecture has four main layers: application layer, data layer, consensus layer, and network layer. Now, if you read the paper, there is another layer called the environment layer, which is basically which involves all these four layers together. But that is not included in this slide. However, you can reference the paper anytime. So coming to the most important part of this video, which is the working and implementation. So in this section, we introduce a blockchain-based solution to process health insurance claims for prescription drugs in a tamper-proof, secure, private, confidential, and trustable manner. The system is built on a private Ethereum blockchain to ensure confidentiality and privacy of records as it contains sensitive information about patients. Therefore, a permissioned blockchain can be viewed only by authorized entities. Figure 2 illustrates the high level. Okay, so there's a figure in the next slide, which I will explain in a bit. So it illustrates the high level system architecture of the proposed blockchain based approach. As it is shown in the figure, there are two smart contracts, the registration smart contract and the approval smart contract. These smart contracts can be accessed by authorized actors through front decentralized applications, DApps. Now, in case you're wondering what DApps are nothing but they're decentralized applications. These are applications that are running on a peer-to-peer network in a decentralized manner. So it consists of front end, and in the back end, it's mostly supported and backed up by smart contracts. So what is happening is that an application is running on a P2P network and it is not at all centralized, so which makes it distributed. And in addition, the system architecture includes an API such as JSON RPC, W3 in Fura. Web3 is something that is very new to us. However, we have suggested this to be included. APIs can be used as linkers between smart contracts and software devices that accesses them. Okay. Uh, And lastly, moreover, there is an off-chain storage system, IPFS, that is used to store large, large-sized files, also in order to maintain privacy within the network. A gateway has been added to filter what can be accessed by patients. In other words, patients will be able to see their own data to maintain parents, other patients' privacy. Now, what we are suggesting here is an IPFS. IPFS stands for Interplanetary File System. This is again a storage system that is in a decentralized manner. Now, if you look at the traditional storage systems, they were location based. So if I needed to share something with you, I would share the location of where the content is stored. That is, let's say on a server, and I would give you the URL. I would give you the location of it. What IPFS is doing is it's making it content based. So based on the content, a hash will be generated that you will be having. And the next time you want to access it or you want to share it with someone, you will ask for the hash in the network, which is again a distributed network. You will ask for the hash uh, to anyone in the net to any node of whether they have it. If they have it, they will give it to you. You can match the hash, you can compare it, and you can make sure that no one has tampered your data. No one has made any sort of uh, changes to the data, to the content that you have uploaded. So IPFS is one of the new technologies that we are suggesting in this system. Also, other other than storage, the other benefit that we'll be having from IPFS is that it offloads the storage from the main blockchain. So loading all this data upon the blockchain will certainly raise issues with related to performance, related to cost, and other features, essential features. So just offloading the storage from the blockchain will help us improve the performance. Moving on. So this was the figure that I was talking about. So it is a high level system architecture of the health insurance claims using Ethereum smart contracts. So these are, by the way, actors. In case you're wondering, actors are basically the people, the authorities that will be interacting to our system, to our solution. So actors accesses smart contract through DApps. So all these are actors like insurance company, physician, physician, patient, pharmacy, regulatory authority. Regulatory authority is the one that will be creating the smart contracts. In our case, the registration smart contract and the approval smart contract. Also, it is the um, authority that is responsible for the registration of insurance companies, pharmacies, the patients, the physicians. So it will take care and it will do the registration in a very secured and confidential manner. So again, as I told you, these are the DApps, decentralized apps. It has a front end layer, and there are APIs. You can see that there are smart contracts, and actors will be interacting with the smart contract according to their need, according to their purpose, whatever it is. And there's an off-chain storage, IPFS, which was used for the storage of all sorts of data, all sorts of e-prescription, and all sorts of logs, transactions, everything. It's done there. Then we have gateway filters. Filter what patient can see to maintain privacy. Obviously, you don't want the patients to see everything. We offer them the data only what they are required to see or they want to see. Actors can access log history and events through the distributed ledger. Obviously, since it's a distributed ledger, it's available with everyone, each node, and anytime it is accessible to any of the actors, to the, let's say, patient. Uh, they can access it and it's traceable even to the ancestral level. Moving on. So the proposed solution is built on a private Ethereum blockchain. So only authorized entities can access and execute functions. Only the assigned regulatory authority is allowed to execute the registration smart contract to register all the different entities that can execute their corresponding functions in the approval smart contract. The registration smart contract has only one regulatory authority, therefore it is declared as an address, while the other are declared as mapped, which means that there are multiple physicians, pharmacies, and insurance companies in the system that can execute the same function. The regulatory authority deploys and executes the registration functions of all authorized entities. There are different enumerating variables in the approval smart contract, including approval request state that contains different states of pharmacy confirmation, such as pending and approved. Now, these are basically the parameters that we are taking into consideration. For example, approval request state. Now, what are the states it can be? It can be either pending, it can be either approved. So, in addition, insurance approval states contain different states of approval requests, such as it can be pending, approved, rejected. And similarly, you can see that, for example, medicine collection state. So it can be either ready for collection or it can be collected. The patient has either collected the medicine or is about to collect it. It is ready to be dispatched. So it can be either of these two. And payment state, it can be either pending or paid. So yeah, so these are the parameters that we are considering. Okay, these are the parameters that we are taking into consideration as inputs for the smart contracts. As I told you before, smart contracts are nothing but they are executable byte of codes, and more ultimately, on a very basic level, they are nothing but they are if then statements. So let's say, if this is the state, then do this. If, for example, uh, if the payment state is pending, then do a certain action. If it's already paid, then do a certain action. If the patient has collected the item, then apply for insurance for the claim. If it is ready for collection, then we wait. We let the patient take the medicine. So these are all the parameters that we'll be considering. So this is this is the one figure. This is one of the figures that will give you a brief about the entire solution that we are proposing. So this is a sequence diagram of all interactions in the proposed solution. Now, from the very start to the very end, you can see all case scenarios were taken into consideration, where first we see that a regulatory authority deploys the registration smart contract and registers the entities. Patient visits a medical care facility for diagnosis and treatment. Okay. Physician prescribes medication to the patient and uploads all the prescription details to the IPFS. And as we told that off-chain storage, we discussed about off-chain storage. So this is where it comes into play. Physicians upload the IPFS hash of the prescription to the approval SC. So here we can see that the physician is interacting with the smart contract, the approval smart contract. He's interacting with the smart contract and he's providing the parameters such as the IPFS hash. Then again we can see that new IPFS prescription is uploaded. Then the patient selects a list of pharmacies. Obviously, he is given choices from the multiple pharmacies that are available to choose from, depending upon his policy and whatever plans that he has taken. Pharmacies are selected. Uh, then pharmacy EA confirms it will proceed the IPFS e-prescription. SC selects the first pharmacy smart contract and announces pharmacy EA. The selected pharmacy requests approval from insurance company. Approval is requested by the selected pharmacy. So again, pharmacy will contact the insurance company and it'll just put a request for just approve it or reject it. Now the insurance company, let's say it approves the IPFS e-prescription. IPFS e-prescription is approved by the insurance company. Pharmacy prepares medications for collections. Now, this is the case where this is the thing where the it gets approved. So in case of approved, then we can see that medications are ready for collection and patient can collect the medication. Patient confirms medication pickup and collection. So he'll confirm that he has picked up the medication or whatever facilities, services, whatever it is, he has taken it, and medications are collected. Pharmacy sends a claim to the insurance company. A claim is then waiting for payment. Okay, so insurance company pays the claim and claim is paid by the insurance company. So this is the case if it gets approved. If all the conditions are satisfied in the smart contract, then the insurance claim is paid and yeah, just normal flow. But if in case it gets denied, if all the conditions are not satisfied, if say if it's a fraud claim, if it is if it's something of an error, abnormality, then insurance company rejects the IPFS e-prescription. IPFS e-prescription is rejected by the insurance company and he does not get the money, or he does not get the service, or he's forced to pay out of his own pocket. So in again we are avoiding the fraud. So you can have a look at this diagram. You can pause the video and you can have a good look at this diagram. Moving ahead. So, as we talked about smart contracts, the registration smart contract and approval smart contracts. So these are basically programs, and programs consist of algorithms. So in this proposed solution, we have 6 algorithms. Now you can see that there is a registration algorithm, prescription creation, pharmacy selection, insurance approval, medication collection, and claim payment. So these are the algorithms that were used in the smart contract. Now, let's say if we take the example of prescription creation. So prescription creation is again done by the physician. So the inputs that he'll be giving are patient ID, drug number, the IPFS hash. So he'll write the prescription and he'll share the IPFS hash based on the IPFS system. Now, what the smart contract does here, as I told you, it's a if else then case scenario. So if the caller is someone who interacts with the smart contract is equal to the physician, then you can add the IPFS hash and emit an event declaring the prescription has been created and uploaded. Else rejected. If you're not a physician, you do not have the permission to upload the IPFS hash. So in that way, the smart contract is working. The physician creates and uploads prescriptions. Similarly, you can see that for pharmacy selection, there is another algorithm. For registration, there's another one. In insurance approval, the most important one we have, and medication collection. Once it is collected, we have to keep a record of whether it was collected, whether it is ready for collection. All this. Thing can be ramped up in this algorithm. Then there's algorithm 6, the final one, which is claim payment. So if all the conditions are satisfied, if everything is right, then the you you can get the claim approved and you get the money. uh, and everything happens normally according to the normal flow. Now, these are basically logs showing a successful creation of prescription, logs showing a successful registration of insurance company. So all these numbers that you see are basically hash. This is something that we don't understand very visually, or we don't grasp it very well. But this is computer language, this is hash, this is of our least concern. We just need to match it, and this is one of the examples of how it's successfully done. So moving on to the future enhancement. So in future work, although the proposed blockchain-based approach has considered important issues, there are still some limitations that should be taken into consideration. For instance, the immutability feature in our proposed solution could be an issue because any human error will permanently store and cannot be modified or deleted. So as we all know that blockchain technology, one of the features of blockchain technology is immutability. And immutability basically means that once something is entered into the records, it cannot be changed. No matter what, it cannot be changed. If you really require to change it, it's done through versioning, through updation. So for example, if you entered a record of A pays an amount of 10 to B, and if it is wrong, then problems can happen. The only thing you can do is you can update it by saying that A did not pay to B, but that is again abnormality and we must avoid it. So that is a future enhancement. In addition, the privacy and confidentiality can be improved by using the Quorum platform that supports transaction and smart contract privacy, where it allows creating private transactions that are visible only to specific participants, which is not the case in our approach, as the transactions can be viewed by all authorized entities. Also, it can enhance the performance of the system due to simplistic consensus algorithm. Consensus algorithm is basically, uh, you can say, a way of validating the records of what is right, what is wrong, of what seems to be a fraud, and what seems to be just a normal transactions. So, based on this algorithm, we will check whether if it's right or wrong. Furthermore, our solution is planned to be deployed and tested on a real Ethereum network, and an end-to-end DApp will be built to be used by different stakeholders. So yeah, we have to build that as well. Our proposed system is carefully designed to be specific yet broad at the same time. It proposes prescription drug claims, but it can also be applied to different health insurance claims types, including inpatient and outpatient. So ours one, the one which we have referenced is very basic and it's very precise, but it's also very general. So you can make just minor tweaks into it, and you'll result into a completely new system. So in our model, we include different actors such as insurance company, physician, patients, pharmacies, and regulatory authorities. The regulatory authority is trusted external entity that is utilized to aid in authentication to align with the features offered by our solution. It can be decentralized if cooperation is established between the participating authorities. Again, this is something that blockchain can solve, and it's only a matter of time when we implement it. To accommodate a different type of health insurance claim, different actors should be added depending upon the requirement, such as therapists, nurses, surgeons, and technicians. So these were not included in this paper. However, we can do that in the future. Furthermore, our proposed solution has two smart contracts: registration smart contract and approval smart contract. Minor modifications to the functions in the smart contracts can be made to adapt to different health insurance claims. Moreover, different health insurance claims will require storing large files to different what do you say requires storing large files to store different examination results. Hence, the system will require off-chain storage. Also, minor modifications are required to be made to the algorithms to adapt to different claims. Furthermore, our proposed solution can also be used to address other claim abnormalities such as abuse error due to intrinsic characteristics of blockchain technology. For instance, unnecessary costs incur due to the use of inappropriate medical services can be easily detected and traced, as all activities and transactions will be approved and stored in the distributed ledger, where all authorized stakeholders in private network will be able to know exactly who was responsible and when it was carried out due to the immutability and transparency of data. So there's something which was not mentioned in the slides, but I would like to add is, while making the smart contracts, we also have to take care of the gas limit and the gas price that was set while making the smart contracts. Now, if you ask what is gas, so gas is simply, let's say, take an example of a car. So if a car has to travel 5 kilometers, and let's say assuming that it requires 5 5 liters of petrol, so 5 liters of petrol were required to travel 5 kilometers. Therefore, we can say that 5 liters were required to get the job done. Similarly, in smart contracts, for each operation you do, there is a cost. Now, that is measured in terms of gas. So, for example, if you used a statement like, let's say, a loop, then there is certain gas price that you have to pay for it. You have to take into the consideration the gas price, because each unit of gas that you used will be having some price. For example, let's say petrol costs 101 rupees right now. So similarly, gas will also be having a price which is measured in terms of V. Now V is the smallest unit of Ethereum, Ether, I would say, and yeah. So using that, you can set the gas limit as well. You have to set the gas limit, because in case if you didn't set the gas limit, and then there is a loop which keeps on going, so what will happen is that to run the smart contract, gas is required. For that gas, money is required, basically in terms of ether. So whatever your account is, until the loop keeps running, money will be detected from your account in terms of cryptocurrency. Now, this is where gas limit comes in. If you set a gas limit, then the loop will not function further, and you can stop it right there, and you can avoid a major blunder in your network. Also, there are other topics, there are other parameters that are taken into consideration while making the smart contract, like the nonce and other things, which you can refer the paper anytime to get a clarity about. Now, coming to the conclusion. So, in this paper, we proposed processing health insurance claims for prescription drugs using blockchain in a confidential, private, secure, trustworthy, and decentralized manner. The proposed system utilizes a private Ethereum blockchain where two smart contracts were developed to contribute to recording and logging events automatically. Also, to deal with limitations of storage, the network was integrated with off-chain storage IPFS to store the large size data that is expensive to be stored on the blockchain network. A security analysis was conducted to demonstrate the robustness and security of our proposed solution against major security vulnerabilities. Again, we have not covered the topic in these slides, but it's there in the paper. The proposed decentralized system provides resilience and security against the single point of failure problem, which is critical to healthcare systems. Lastly, the proposed system can be generalized to serve different health insurance claims like inpatient or outpatient. Coming to the references, so for simplicity, we have kept it to six, but there are other references that we took into consideration. These are some of the main ones that we took into our account. So yeah, these are the references. You can go ahead and have a look at them. And coming to the last part, so thank you everyone for sparing your time and listening to this video. We believe that you learn something new every day, and I hope if you have I hope that you have watched the entire video. And if you have watched the entire video, then I believe you're someone who is very curious or someone who is very keen about this technology, or you're just my friend, relative, or let's say a kind and sweet person on the internet. So there's just one more thing that I would like you to do is that give this video a like and do share it with your friends. I hope this video was helpful to you in some or the other manner. That's it for now. Thank you very much. Keep learning, keep exploring.